Great. Thanks, Madison. Good evening, everyone. My name is Bill Heckla, and as chair of the South Bruce Grey Health Center's Board of Directors, I'd like to extend a warm welcome to our Zoom participants and Facebook Live viewers as we begin this evening's virtual community information session. I'm joined this evening by a panel of South Bruce Grey Health Center board members, staff, and physicians, including Dr. Lisa Roth, our Chief of Staff, Holly Al, our Director of Clinical Services and Chief Nursing Executive, and Michael Barrett, South Bruce Grey Health Center's President and CEO. Together, the group will provide an overview of the ongoing human health resource challenges being faced across the province and South Bruce Grey Health Center's action plan to return services to full operation. With that, I'll welcome Michael Barrett to begin this evening's presentation.
Thanks very much, Bill, and I appreciate everyone taking the time tonight to join us for this conversation. Our format for tonight is I'm going to go through an overview, kind of describe the situation where we stand now, and talk about what we're doing to address this challenge that we're facing with our nursing shortages, and provide you with an update on our recruitment and retention action plan. Just before we do that, I'm going to go through some housekeeping items. So for those of you on Zoom, and hopefully most of you are familiar with Zoom now after 2 years of the pandemic, along the bottom of your screen is a menu bar. On that menu bar is on the left-hand side, you can see a mute button and a stop video button. If you want to connect your video, click on that start video button and your video will come on. At the point in time when we start to look for questions from the members of the public, there's a button at the bottom called chat. So on that chat, you can click on it, and then there'll be another menu come up and it says raise hand. If you want to speak and ask your question as part of the presentation tonight, click on that raise hand and we'll go to you, and your microphone will be unmuted by Madison, and you'll be able to answer your question. Right now, we're not opening up the chat function. We'll do the presentation first. And once that concludes, then there'll be lots of opportunity for people to have their questions answered. The other option is to, on that chat button, you can go in and the chat box will pop up, and you can type in your question, and we'll read out your question so everyone can see it or hear it, and then we'll respond to your question again. And if you're joining by Facebook Live, which I know a number of you are, you can enter your questions or comments. We'll enter them into the Zoom chat box, which I described earlier, and then the panel members will be available to answer. The panel members, as was shown on that first slide, include myself, Bill Heckla, who's our board chair, Holly Al, who's our Director of Clinical Services and Chief Nursing Executive, and Dr. Lisa Roth, who's our Chief of Staff for the South Bruce Grey Health Center Corporation. For those of you joining in by phone, there's a couple of options here for you to raise your hand. So if you want to ask a question, you can press *9. This will allow us, the panel, to know that you have a question, and then please wait to be addressed. And then *6 is to mute or unmute your microphone. And I've asked all of you to keep on mute during the presentation, as well as when other people are asking questions, so we don't have a lot of background noise. I'll just reemphasize again that the muting and unmuting for the Zoom call will be done by Madison. She'll be able to, if you have a question, then she'll unmute your microphone, which will allow you to speak to the group. On Facebook Live, this session is being recorded and will be broadcast on Facebook Live, as we said. And then the recording will be available on our Facebook page after the session. Also, this deck that we're going to walk you through tonight will be available for people to see and access. And if I'm going quickly through some of the information and you want to look at it in a bit more detail, please do that after the session tonight. So the headline in all this is that our immediate and primary goal is to return all of our services to full operation as soon as possible. And we've implemented an action plan to accomplish this. And as I said, we're going to walk you through the situation that we're facing and then what we're doing to address it. This is just some background on our services and geography. I won't go through in detail, but we do have the 4 sites, Chesley, Durham, Kincardine, and Walkerton. On the map, the hospital sites are the ones that are, our hospital sites are the ones that are in the green square. But you can see there's other hospitals in our jurisdiction, our area, including the Hanover Hospital in between Walkerton, Chesley, and Durham, Wingham and Listowel to the south. And then to the north, we have Grey Bruce Health Services, which has a 6-site corporation, including locations or communities like Markdale and Southampton and Owen Sound. So the background, if any of you participated in the community information session we had back in December, you know the situation that we're facing. I'm going to just cover some of this material again for those that weren't part of that presentation. But we have been facing significant health human resource shortages for the last 5 years, particularly in nursing and laboratory. As a result of that, we reduced the hours in the Chesley Emergency Department back in September of 2019 due to nursing shortages. That ED is operating from 8 a.m. to 8 p.m. and closed overnight. And then in December of last year, the hours of operation, again, due to nursing shortages, were reduced. The hours of operations were reduced in the Walkerton Hospital Emergency Department. Again, it's now operating from 8 a.m. to 8 p.m. and closed overnight. As part of our changes back in December, we also converted the inpatient unit in Chesley to a unit that cares solely for alternate level of care patients. So alternate level of care patients, or ALC patients, are those patients that no longer require hospital care and are waiting to go to their next destination. And I'll talk a bit more about that on the slides. So what's the cause? Why are we facing this nursing shortage? So at the heart of it, there's an overall shortage of nurses across the province, across the country, and worldwide. You look at any of the literature that's right now looking at this issue. There's shortages of nurses across many jurisdictions. So again, what else is behind that? So we've been through 23 months of a pandemic. Nurses and all healthcare workers are feeling burnt out from that response. That could be part of how we're doing business differently. I've said numerous times that hospitals have changed from what they were prior to COVID to what they are now. Hospitals in the past were community gathering places where people would come to see friends, go to the gift shop. Things have changed tremendously. And for our staff, it means going in and out of patient rooms, donning and doffing, taking on and taking off personal protective equipment, which is very cumbersome, difficult to do, and challenging for all of our staff, whether it's nursing or other members of our team. Another issue in rural communities is the unique nature of rural nursing practice. Nurses in rural communities do more than their have responsibility for different parts of their do more things. I guess I'm trying to describe what I'm saying here. They do more, provide more service than their urban counterparts. So, for example, I'm doing a good job of explaining this. In a rural setting, if they need a respiratory therapist, it's themselves, the nurse. Whereas in an urban center, they can call for a respiratory therapist. For lab work, many of our nurses are required to do lab work. Clerk work, the administrative part of the job. In many urban communities, that clerk work is done by an assigned person. In smaller sites like ours, it means that the nurses are doing much more than just their typical nursing practice. There's also many other nursing opportunities across the system. We know with COVID that there's positions that have been created for vaccination centers, assessment centers, which allow nurses to work typically Monday through Friday, no overnights, no weekends, which creates other opportunities for our nurses to go to. We also have challenges backfilling our staff when they go on leaves. So in the past, if a nurse went on a leave, there was a pool of nurses available to fill those staff and backfill those positions. Right now, we don't have that opportunity. And then finally, for us at South Bruce Grey, and I think this is a critical point for us in terms of our difference, our clinical leadership has been thin over the last number of months. And nurses want to know who their leader is, want to have that leader close to them, be able to coach them, answer questions. And again, we've been very thin on that clinical leadership piece. One point of clarity here is that we have had the reductions in the emergency department hours in both Chesley and Walkerton and the changes to the Chesley inpatient unit. There was also another cause of a reduction in service back on January the 5th. So on January the 5th, the Chief Medical Officer issued Directive Number 2, which required all hospitals, us, big and small hospitals across the province, to pause all non-urgent and non-emergency surgeries and procedures. This was to free up staff to allow us to respond to the Omicron wave that was coming through the province at that time. So you would have noticed that we had less outpatient lab visits available. We reduced surgeries, reduced opportunities for diagnostic imaging. That's separate and distinct from the situation that we're facing with our nursing shortages. The good thing is that Directive Number 2 was lifted on February the 10th, and which is allowing the gradual resumption of these surgeries and procedures. A bit of provincial and national context. I talked about the nursing shortage being faced not only in our hospital, but across the province, across the country. Ontario has the lowest RN to population ratio in Canada. So we have a 665 RNs per 100,000 population. You compare that to the province which has the highest RN to population ratio, which is Newfoundland and Labrador, and they're at 1,097 RNs per 1,000 population. The Ontario Nurses Association reports that Ontario requires 22,000 new RNs to enable the appropriate staffing of hospitals and other sectors. And just yesterday, the Ontario Hospital Association is calling on the province to hire 10,000 additional RNs. The province has recognized this issue, and I'll talk about some of the interaction we've had with the province. They've recognized this issue by creating a new provincial committee on health human resources. That committee is now meeting to try and address these shortages that we'll be talking about tonight. They held an HHR summit on November 30th. There's another one coming up on March the 4th. And I've been asked to sit on that committee because of the challenges we're facing here and really advocate for small rural hospitals that are facing these challenges. We also have patient capacity challenges in the hospital. So all 4 of our sites, our inpatient units, have been operating close to or above capacity for a large percentage of the time. There's some other system impacts here, and I talked about the ALC, alternate level of care situation. At South Bruce Grey, at any point in time, we have between 35 and 39% of our beds occupied by patients designated as ALC. This means the patients are in hospital, no longer require hospital care, but can't get to the next destination, whether it's long-term care, supportive housing, home with home care, because those options aren't available to them. Part of the reason is when COVID, the pandemic first started, there was new restrictions brought in for long-term care homes, which restricts ward rooms in long-term care homes to 2 residents. Previously, those ward rooms could have been 3 residents or 4 residents. This is great from an infection control standpoint, but it means that we have 147 less long-term care home beds here just in Grey Bruce. So it's 147 less places we have for patients to leave and be discharged from hospitals when they need to move to their next destination. This is just another way of describing that situation with alternate level of care. The numbers don't matter here. It's the shape of the graph. At the left is the April 2018. At the right is December of 2021. This is the total number of patient days in our hospital that are occupied by patients designated as ALC. So back in April 2018, it was about 100. You can see now it's up over 600. So these are patients that no longer require hospital care that we're still caring for because they can't get to the next destination. So our board fully recognizes that these service reductions that have been put into place are not acceptable to our communities, not acceptable to our municipal partners, not acceptable to any of any of you that are listening tonight. and the board's committed to restoring these services as soon as possible. We implemented a recruitment and retention plan back in September of 2019 when the reduction in hours first happened in Chesley. It's now been updated, this action plan, with immediate actions to address the nursing shortages we're facing with nursing shortage we're facing now that have resulted in the reduction in services in Walkerton. So these next few slides are going to walk you through what we're doing to address the both on the recruitment front and on the retention front to get us to the point where we can restore services. So I'll go through the actions and give you a progress on each of those. So again, our work on recruitment and retention started back in September of 2019 when Chesley first went to reduced hours. These are some new items that have been added more recently as we face the new reductions in services. So we've created 3 new full-time single-site RN positions. So these are RN positions with unmastered lines, which means they can be deployed to different parts of the hospital. 2 are in Walkerton, 1 are in Chesley. And the important point here is that these positions are above and beyond our regular staff complement. So you would never do this in regular time because it means that you're actually hiring more staff than what you need, which you can get the hospital into financial peril. Secondly, we've been hiring agency nurses. So there's companies across North America that provide nurses for hire. So we've reached out to 9 different agencies. There's the number of new agencies providing this service is increasing considerably, has increased considerably with the pressures everyone's facing around nursing shortages. We've hired 6 agency nurses. They've signed contracts with us. 4 have been oriented and are currently filling shifts. 2 are expected to start the next 2 weeks. And we've got more interviews being lined up. Just one piece of information that's really important here. When agency nurses start, you still have to get them oriented to your site. We need to get them filling those vacant slots in our shifts, or sorry, in our schedules. If there is a vacancy in our empty spot in our schedule, I should say, those empty spots have to be offered to our own staff first before we can offer them to the agency nurses. So there is a lag here in terms of getting the agency nurses hired, getting them oriented, and then being able to actually deploy them into those vacant spots in the schedule. But we're making great progress, as you can see, and this will be a key point of our part of our getting services reopened. Casual RNs. So we now have 6 positions that we posted both internally and externally for casual nurses. So these are nurses that are not full-time, not part-time, but can be called in to work when we have empty spots in the schedule. We had to change some of the language in our local collective agreement to make this happen, which we've now done. We've also sent out communications to all of our nursing staff. So Holly Al, our chief nursing executive, sent a communication to all of our nursing staff saying, if any of your colleagues or friends or people you know in the nursing profession are interested in this position, please have them apply. Our human resources department has also reached out to all RNs who have recently resigned, but have expressed an interest in coming back for a casual position. And it could be that they have another job elsewhere. Family commitments, they didn't want to commit to a part-time or full-time position, but we've done that to all those folks that have recently resigned. Interviews are being completed, offers are being extended as we speak. So should have some of those on board shortly. We're also a big part of nursing recruitment, getting nurses into your organization, are students. So we have a nursing student externship program where we offer positions to nursing students to allow them to get their placement experience. And then once they've graduated, do their experience before they write their exam and get their designation. We've offered out positions to 11 nursing students, 6 fourth-year students, 2 third-year, and 3 second and first-year students. They'll be starting over the next number of weeks. Orientation is being set for this Friday. There's a cost to this, so it's about a cost of $289,000, but obviously we believe it's a wise investment to get those nurses involved and engaged in our organization. We also developed an internationally educated nurses program. So these are nurses that have been trained outside of Canada, don't have their nursing license in Canada right now, but are eligible to work. So we actually received 140 applications, shortlisted 50, spoke to did telephone interviews with a number of them. To date, we only have one eligible candidate who's met the requirements for the position, and that person is being, I think, interviewed this afternoon. So I don't have a current update, but being interviewed this afternoon. There's also a corresponding provincial program on internationally educated nurses. It's called the Supervised Practice Experience Partnership. It's through the Canadian Nurses, CNO in Ontario Health. We've applied to that program. We've actually been matched with 5 nurses to date. We're only looking for RNs. We have the RPNs we require. One of the RNs was actually from out of province, from Saskatchewan, was not intending to stay here after their placement. Now, just a quick story of why that doesn't work for us, because we would bring this person in, they would do their placement with us. They're not a nurse yet. They'd still have to get their designation. But if they're not willing to stay with us, we invest in that experience part. But if they're going back to their home province, we ultimately don't get a nurse at the end of the day. So if that scenario doesn't fit for us, there's one other RN that we're waiting on a response from right now. So hopefully we'll see something shortly. Registered midwives. So this was actually a suggestion that was brought forward at our last community information session in December. We have midwives in our family birthing center now that come in and assist the mom with the labor and delivery. This is a bit different, where we'd actually be putting a registered midwife on contract. They'd come in as a contract staff person to help fill some of the vacant shifts in the family birthing center. So they would provide backup and support to the RN that's working in the family birthing center now. They obviously bring a great skill set. It's a different skill set than nursing. And we are just in the final steps of finalizing the contract with 2 midwives right now. Also working with our insurance provider, which is called HIROC, HIROC, to make sure we've got the proper insurance requirements to bring them into the family birthing center. And then finally, with all of this activity around health human resources, our human resources department is very, very small. We've hired another recruitment coordinator to help with all this work. So that person started yesterday. It's going to be here to help our human resources team. So that's all the recruitment initiatives that we're doing. I'm going to switch gears and talk about retention. 2 fronts here. I'm going to talk about existing retention efforts and then new retention efforts. So I'll go quickly through these on the existing retention efforts. One key part of our outreach and connection to our staff is our weekly organizational health town hall meetings. So every single Thursday afternoon at 1 o'clock, we have a Zoom call just like this. And typically we have, it'd be 50, 60, 70, 80 of our staff on the call. We also record it for people to watch later. Often when I'm out at one of the sites, I can hear the town hall being replayed when nurses have a bit of downtime to be able to watch it. But why I talk about this is that we do a presentation at the start and talk about updates that are going on. And through COVID, there's been lots of change. So they get an update from me, from the chief nursing executive, from Dr. Roth, Dr. Lindsay Bowman, who's been fantastic throughout our COVID response. But they can also ask questions. So our staff can ask questions in advance or put it in the Zoom chat box, and we provide answers in real time. So I say anything's game as long as you're doing it in a respectful manner. We can answer the questions. And so it's for a couple of times when things slowed down on the COVID front, we talked about eliminating them, and staff still wanted to move forward with them. So we're continuing to do these, and we cover all kinds of topics. Back in when I first came to South Bruce Grey, a big concern of nurses and many other staff was not having enough training and education. So we did hire a professional practice coordinator in the spring of 2020 that allowed us to provide more local training and education opportunities. And that's Holly, who you'll hear from tonight, is now our chief nursing executive. Holly was previously in that position and did a great job. We also submitted a sustainability proposal to the Ministry of Health back in February of 2020. So we did this in partnership with the here in Perth Healthcare Alliance, because they have an emergency department that's on reduced hours in Clinton. So we've done that to make sure that the ministry knows how they can support us. We have met with the ministry, we have met with Ontario Health. So the proposal's there with them, and looking for some support from the provincial government there. The last item on this list is our board. So every single board meeting since the Chesley Emergency Department has gone to reduced hours, this item has been a standing item on the board agenda. So the board talks about it every single meeting, and so it never is lost. We never lose sight of the issue for trying to address the situation. A few more retention efforts that we've done that are already in place. We have a much strengthened orientation program. So when new staff come in, it's a competency-based orientation program. We've purchased new education resources. So Elsevier is a service that provides best practice videos and information and pictures for different levels of care that can be provided by all kinds of healthcare staff. We do 30, 60, and 100-day check-ins with new staff. We've also worked with the Ontario Hospital Association to address the impact of Bill 124. So this is the bill that requires all public sector organizations to limit wage increases to 1%, which includes nurses and healthcare workers. So when the bill first came into place, the OHA did meet with the Treasury Board President, the Minister of Finance, and to see if it could be, to see if nurses and healthcare workers could be excluded, and government didn't move forward with that. So we continue to advocate together with the Ontario Hospital Association. And then on the softer side, there's a number of things that we do to make sure that we show the value of our staff to the organization and to our communities. Last December, we had the 12 Days of Christmas, where we had a daily draw for a $50 local restaurant gift card. People had to submit why they like working at South Bruce Grey, and we had a draw with the people that submitted their name. Last June, we had the Employee Appreciation Week. So we had daily prizes all 5 days, the complimentary food truck meal for all staff at each of our 4 sites. And that was supported by our 4 foundations. So our 4 foundations have been fantastic in supporting our hospitals and our staff, and they did that with the Employee Appreciation Week. We also have our annual Service and Excellence Awards. So we've done them 2 years. We'll be doing it again this June, where peers can nominate their colleagues for 4 different areas around leadership, quality, for folks that they believe support our hospital's mission, vision, and values. Cheers for Peers. Every single week on our organizational health town hall meeting, people can recognize their peer for a great job. So it's a short little blurb that they can say, Betty Sue, I really appreciated what you did to support those patients last week, and we recognize those staff for doing it. And there's some draws for participation in doing that. We also have appreciation gifts on holidays. So at Christmas time, we had the hot chocolate bomb and a mug for all staff at Christmas. We had personalized Valentines with Mill Creek chocolate. And one other piece I should add on here is that our board of directors, who are all a volunteer group, so our board receives no compensation for the job they do, out of their own pockets, bought a package of goodies, butter tart, cannoli, number of different things in a box for all of our 400 staff. So hopefully that gives you an idea of how much our board values our staff and what they mean to them when they're dipping into their own pockets to do that and provide that for our staff. Okay, and so finally, I'm going to talk about some retention efforts that are new. We've held a number of nursing focus groups. So we need to hear from our nurses, what's on their mind, what can be improved, what are opportunities for change. And I'll talk about a bit about those in just a couple more slides. One of the key pieces of feedback we've received from our nurses and many of our staff is around our scheduling practice. Our scheduling process is not strong. It needs improvement. We've recognized this for a while. So prior to the reduction in service, we had actually contracted with consultant to come in and look at our scheduling practices. It's a group called Workforce Edge. They work in other hospitals across the country, and they're not selling a software product or any software. They're just there to help us with our processes and practice. They've been extremely helpful. They'll be wrapping up at the end of March, and will leave us with business processes for us to do a better job in the future with scheduling. We're also looking at financial support for our social and wellness committees. So all 4 of our sites have, to limited or different degrees, social and wellness committees, but we want to provide them with some resource to financial support to help move some of those initiatives along. We're also exploring opportunities for investment in staff lounges. Coffee machines, a common comment we hear is there's no coffee machines in the hospitals. So we're looking at creating those staff lounges or wellness sites or wellness lounges for our staff. And finally, some other initiatives that we're looking at, exploring enhancements to our education program. I mentioned about the students and the internationally educated nurses. All of those people require a mentor or preceptor, but we need to train our mentors and preceptors to make sure they can do a good job and feel confident in providing that oversight for those folks. So we need to provide more support there. We also need to do a better job with peer support. So in hospitals, we can see some very tragic situations that do require support from colleagues, from leadership. So we need to make sure we have an employee assistance program in place, but it's something that we can certainly improve upon. And we want to brand ourselves as being an organization that people want to be a part of. But we're not doing that until we get to the point that we think that we are at that point. So we want to get there to make sure we can brand ourselves. And I'll talk about foundation support. The foundations in all 4 of our sites are fantastic in supporting our staff in each of our sites. So just a bit more on the focus groups for the nursing, our nursing staff. We wanted to get input and advice from our nurses. So we had 4 different focus group meetings on the week of January 17th, 20th. Nurses joined in on a Zoom call like we're doing now, provided feedback, and I'll talk about some of the highlights from those from that feedback. We then held a summary focus group last week to discuss the actions, discuss the feedback, and then the actions that we could take to try and address some of those items that were raised at the focus groups earlier in January. And then this week, we actually had a focus group with new nurses. So nurses that have been with us for less than a year. And I saw one of the nurses today in Durham. I thought we didn't have to pull information out of them to hear what was on their mind. They did a wonderful job, gave us all kinds of advice about what is valued to them. So I think that's really important for all of us that we're hearing from both seasoned nurses and new nurses as we make our decisions about how to improve things. So some key themes from the nursing focus groups. A big one is scheduling. Second big issue is vacation. And the vacation piece is really key. And I've said this when I've done any presentations to the groups about this. Right now, nurses aren't always getting the vacation that they want. We're denying vacation. And the simple reason is that we need those staff to be able to continue to operate the services that we've got. But that is not a great way to run an organization. And if you want to create a culture that people don't feel valued, is not giving them the vacation that they want. So all of these initiatives, we need to get back to being able to allow nurses to take the time that they need to, because their time away from work is very important to ensure they can do a good job at it. So we have the scheduling review underway, which I've talked about, and we're also looking at different staffing models and lines for each of the departments. Moving from left to right, communications, relationships, leadership presence. I've talked about our clinical leadership being thin. I'm very happy to say that we've got 2 new clinical directors in place. I've talked about Holly. Our second clinical director, the Director of Clinical Support Services and Ambulatory Care Services, is Mandy Dobson. Both started within the last month. They are both existing South Bruce Grey Health Central employees that bring a lot of experience and leadership to those roles and are the key part of rebuilding that leadership team. But we need to have leaders with an increased presence in each of the departments. We need to make sure our performance reviews are being completed so nurses are getting feedback. And I've talked about the financial support for social committees. Education, we've done a great job here, but I think we can do better. Not better, we can do more. And so some of the programs listed here, those acronyms, I won't describe them, but they're requirements for nurses to fulfill their role. We also need to look at how we're oriented or reorienting staff that are coming in. And I talked about the training for preceptors. And then finally, on the right-hand side is the staff lounges, which I've mentioned already. And we've got plans in place to put in those lounges at each of the 4 sites. And we've surveyed our staff to see what they want in a lounge. They want something quiet and dark. They want something bright and cheery. So we're getting that feedback from our staff. I've mentioned our foundations a couple of times, and the message I want to deliver here is that our foundations have been fantastic in supporting our hospital and our staff. And during these reductions in service, I think unfairly some of the criticisms have been directed to our foundations. Please continue to support your foundations. They are integral to us being able to provide the up-to-date equipment that we need to care for all of you, to care for our staff, and they do a wonderful job. And we're just in the process of getting approvals from all the 4 foundations for their capital investments for next year. So can't say enough good things about the support we've got from our foundations. Okay, and I'm going to wrap up quickly here. The next 2 slides are engagement activities. So since the reduction in services, we've met with a number of different groups, a number of times. We met with our hospital foundations. We've met with the Aaron Elderslie Municipal Council. We've met with the municipal mayors and CEOs. We meet with the municipal mayors and CEOs once a month. We were meeting twice a month to give them an update on what's going on inside the hospital. We do that together with MPPs Lisa Thompson and Bill Walker, and also some of the police services join that call as well. It's on a Friday morning at 8 o'clock, and we go through what's going on in our inside our hospital. And then our board chair had a telephone meeting with the Brockton mayor in February. We've also met separately with the MPPs on January the 26th. And many of you on the call will be familiar with the Friends of the Chesley Hospital and the Friends of the Walkerton Hospital group. We met with them on January the 29th, and then again on February the 7th. The first meeting was with the MPPs. In terms of engagement, we also took out a full-page ad in the newspapers in Walkerton, Hanover, and Mildly last Wednesday. And throughout all this, we've had the action plan that I described in Q&A has been on our website since December of 2021. And many of our board members and myself and our leadership team have responded to numerous individual questions from community members. There's been a question about our board membership. So our board is a skills-based board. I talked about the dedication that they have. They're all volunteers. They do this because they care about their community. Their goal is to maintain 4 strong, viable sites. They recognize that we're not there now. We need to get those services reopened to be able to accomplish that. The board has a very public recruitment process to attract new members, which happens every March in anticipation of the annual general meeting in June. And the decisions around these service reductions were made on the principles of least harm and using resources as effectively as possible. There's been questions about the board does not have a director from the Brockton area. That's right. But I'll say that over the last 2 years, we've recruited heavily in the Brockton area, sent out letters to local businesses and organizations in the Brockton area, also in Durham, because we're looking for Durham reps, without success. So if you do have an interest in being a board member for the hospital, please contact us, contact Madison, then there'll be notices in the newspapers in March. My last slide here, and then I'm going to pass it back to Bill. Everyone wants to know when we're going to be reopening these services. We've been clear that these reductions in services are temporary, they're indefinite. We do not have a timeline at this stage, but we're doing modeling to identify all those recruitment and retention initiatives that I described, how many new health human resources are going to be coming into the organization. We know which nursing staff are going on leave, which nurses are returning on leave. So we're beginning to model now that we're seeing some of the implementation of those strategies when we can actually get to that point. We know back when we started this process, it's 5.1 full-time equivalents that we need to restore services in Walkerton. And then in Chesley, it's 3.7 full-time RNs that we are required to restore services in both the acute care unit and the emergency department. And a full-time equivalent is a nurse who works 37.5 hours per week. So with that, I'm going to pass it back to Bill just to wrap up, and then I'm happy to open it up for questions.
Okay, thanks, Mike. So on behalf of the South Bruce Grey Health Center and its board of directors, I want you to know that we hear and understand the strong desire of the community and our partner organizations to reopen and to provide a date at which that'll happen. But as Michael has said earlier, our immediate and primary goal is to return all of our services to full operation as soon as possible, and we're taking urgent steps to accomplish this. We have said that these service reductions are temporary and indefinite, and that we're not able to provide a definitive opening date at this time. But as Mike said, we've been modeling it, and hopefully we'll have be able to predict in some short order when we'll be able to return services back to normal. It's important to know that our core principles are to provide that care is safe and to not further deteriorate our staff. And we will not jeopardize the safety of our staff or patients to reopen the emergency departments. So what I'd like to do is I'd like to open the floor now to questions.
Okay, so just a reminder, if you want to, there's two ways you can ask a question. One is to, in the chat box, put your hand up, and when your hand is raised, then Madison will open up your mic and you can ask the question verbally. The second way is to actually type your question into the chat box that's there, and you can see that we did receive one question in advance, which Megan is listed here. I'll just let well, maybe I can start to address that question, and as more questions come in, please put them in the chat box or put up your hand, and you can start that process. I'm going to read the questions because in the recording of the Zoom call, people can't see the questions as they're typed out. So forgive me as I read it here. So question submitted in advance. I've looked at the registered nurse job postings. Why are you insisting new applicants have to be vaccinated? There's no policy stating staff have to be vaccinated. There are nurses who have lost their jobs in other hospitals due to vaccination requirements who can apply for these positions. All frontline staff have cared for patients for almost 2 years without vaccination requirement. Why are they not good enough to hire now unless they're vaccinated? So there is a policy in place. South Bruce Grey Health Center passed a policy that requires all all new staff, volunteers, physicians that are joining the organization to be vaccinated. So that policy is already in place. I can say the majority of hospitals across the province have the same requirement in place. The one difference that South Bruce Grey has from many hospitals in our region is that we've followed a directive from the Chief Medical Officer of Health, which gives people 3 options around vaccination. So it's not mandatory that people have to be vaccinated for existing staff to work here, just the new staff, which I mentioned earlier. But for those staff that remain unvaccinated, they had to test with a rapid test 48 hours in advance of their shift before coming into work, and obviously have to have a negative test. So that's the process we've been following. And those staff, it's a small number of staff that are unvaccinated, have been diligent in completing that testing before coming to work. Okay, so another question has come in. And one other thing I'll do is I'll triage questions. So if it's for Bill or for Holly or for Dr. Roth, I know Dr. Roth is going to have trouble getting here earlier. So Lisa, can you just let me know if you're online?
Mike, maybe before you go to the chat box question, Bruce Jacqueline has his hand up and I've unmuted him.
Yeah, go ahead, Bruce.
Okay, I just have a comment, Michael. I was part of the meeting that we had between you and the chairman and our board. I left that meeting a little disappointed in that I thought things hadn't happened since we first got, we were 2 years, 18 months, and we first got kicked and the second time we got kicked. I think you felt our sorrow or whatever, but I'd like to comment in saying I think more has happened in the last 2 months than has happened in the last 2 years. And I see some more positives than negatives. So I'd just like to congratulate you on that in some progress. I feel I don't want it to end, but I think we've had more progression than recession.
Thanks, Bruce. Appreciate the feedback. And yeah, we need to get this solved. And we've got some challenging circumstances outside of our shop with the provincial and national picture, but we need to get this solved for sure. And Megan, I can't see if people are putting up their hand.
I'll keep my eye on that. There's nobody at the moment if you want to go to the chat box.
Yeah. So first question from a number. Why has it taken until now for you to create a real plan for recruitment and sadly last year retention? What was the plan back when you closed Chesley ER at night? Please share. So if you were part of the community information sessions that we had in Chesley, so I think we had 4 of them, 2 in person and 3 probably virtual like this. We focused a lot on that education and training piece so that we had new nurses coming in, but something I didn't mention in the presentation is new nurses still require experience and skills development before they can work independently with confidence in an emergency department. So we can hire new grads, but they're not in a position for 2 years, 3 years possibly before they have the confidence to do that inside the in the emergency department. So our focus back in 2019 was really around increasing the skill set and experience of those novice nurses, and that's where we spent the majority of our time. Next question from Greg McLean. All right. Will the board be reviewing the third-party review initiated by the municipality of Brockton for possible ideas for the recruitment and retention plan? So again, the South Bruce Grey has been very clear that we were not part of the selection of this third-party reviewer. The person was selected independently and solely by the municipality. We appreciate the recommendations that are in the recruitment and retention plan. Many of them, of the recommendations have already been addressed through the action plan that we've talked about tonight. So it certainly will be something that we'll review, but it's not something that we're using as a source of, a resource that we'll be using to inform our decisions. It was not, did not engage the full complement of folks that we would normally engage. Wasn't supported by us as an organization. There was no interaction with leadership team or our board. Wasn't supported by the regional union office. For our unionized staff to be speaking with the reviewer. So in our eyes, we're doing everything that we need to do, but we'll certainly we'll review it, and if there's something there that could be helpful to us, we'll certainly take it into consideration.
Hey, Mike, if I can step in, 2 things. One is we hope to meet with our local councils, and the offer's always been there. And the other is that we welcome all constructive ideas. And as you mentioned earlier, we had the great idea around bringing on midwives to the birthing center at one of our earlier sessions. So we encourage people to step up with great ideas, and we'll certainly implement them if we can make them, if they're attractive.
Thanks, Phil. And Madison, can you tell how many people are on Facebook Live, just for people's?
For sure. There are 31 users on Facebook Live currently.
Yeah, thanks. And we've got 82 people on the Zoom call here. Okay, next question is from Chanel. So thanks, Mike and team, for your ongoing efforts. I just wanted to express that I've heard feedback from several physicians and community members how having no active beds in Chesley has affected them. I'm concerned for our nurses and physicians who want active beds included in their scope. I'm thankful for the support of the other sites for our patients accepting admissions, but it's challenging for families and patients not being close to home and not having continuity of care. I hope South Bruce Grey will take into consideration when this comes time for steps to reopening. With 35 to 39% ALC, has there been applications to increase long-term care home beds in our area? So I'll address the first part first, Chanel. We too want to get back to, so I'll back up. Chesley is an 18-bed hospital. 8 of those beds are acute beds, so medicine surge, med surge beds. The other 10 are senior center of care beds, which we use for the transitional care unit or those ALC patients. The acute beds means that they receive all the care that's required within a hospital. Moving to ALC means that those folks that require acute care need to be moved off to another site. One key point here is that we do have 1 acute bed that's remaining in Chesley, but we do want to get back to having those other beds in place. This is, when I go to Chesley now, nurses are disappointed, our physiotherapy department's disappointed as we aren't acting as that transitional care unit that we had in the past. So our goal is to do that, Chanel. And again, it's all, we need to get our nurses in place to be able to reopen. The 35 to 39% ALC rate, the purpose of us putting it in the presentation is this is huge. This is over 1/3 of our beds are people in hospital that no longer require hospital care. So we work closely with our long-term care home partners, myself and our C&E meet with the long-term care homes every Wednesday morning, the 19 long-term care homes in the county, to help with that transition point. But they're in the same spot as us. They have staffing challenges that are making it difficult to completely fill their long-term care homes. So we're working with them, and the idea of new beds coming into the area. That's another question that's been asked on previous calls. So we're working with the ministry now to identify exactly what new beds will be coming to Grey Bruce. And Greg McLean, thanks for the question about the third-party review. MPP Bill Walker, who, as I said, we met with. Hi, folks. My apology. I was in the speaker's chair today, and the House just rose for the day, and I have a previous commitment off-site. Please forgive that I'm not able to be on the call for long. However, please be assured that I have been and remain engaged in this matter along with MPP Thompson, and am updated on a regular basis by Michael and Bill, as well as meetings with friends of group, and also the Ministry of Health in Ontario. Regards, Bill. Laurel Headley. Michael, you mentioned that safety is a big concern for you and your board. Do you realize the risk and liability involved when your nurses cannot take breaks, picking up extra shifts to keep things afloat? If a nurse is not functioning 100% because of exhaustion, this is a safety issue for patients and nurses. Can you answer this? So maybe I'll let Holly, you want to tackle that one with the impact on our nursing team?
Yeah, I can speak to that. I mean, I absolutely agree. I think that the treats and the food and that I think everyone would agree is supportive to our nurses, and they appreciate it. We had some excellent treats and circulated by the board members, as Mike mentioned earlier. And when we did our rounds out around to talk to staff, it was very well received. It's just a nice gesture that they were able to do as kind of an extra little thing to show appreciation. In terms of, the exhaustion and staff picking up shifts and having to work extra. That's why we have these closures in place, and we really emphasize that we won't be able to reopen with jeopardizing our staff safety or further deteriorating our staff. We need to make sure that we're not asking more than we're already asking of them now. We have a significant number of staff that are very dedicated to our communities, to our patients, and to each other. And so they do continue to go the extra mile to make sure that they're supported. That's what we're all kind of working together as a team to put these initiatives in place so that they do have we have more staff in the pool to pick up these shifts, and we're able to fill these vacancies and ensure that we're in a good spot before we open our department, so we aren't asking more than staff can safely do.
Thanks, Holly. And that is a really key point that Holly made, is that these reductions in services are to ensure that we don't further deteriorate our staff. Because through the fall, Labor Day weekend, Thanksgiving Day weekend, we are asking nurses to go above and beyond to make sure that we keep services operational. All that does is lead to further burnout. So we're doing this to ensure that we protect our staff. And the week before we implemented these service reductions, we actually had 2 nurses here in Walkerton that worked 24-hour shifts. So that's not safe for patients, not safe for the staff, not acceptable to the community, and certainly not a sustainable approach. So the reason we're taking these steps is to ensure that we protect the staff that we have working for us. And Sharon Musell has a question.
Are you surprised?
No.
Okay, here goes. I have a couple questions and then I have some comments around that. So Holly, have we hired anyone into Chesley in the last couple of months since ALC?
Have we hired any nurses into Chesley?
Any RNs into Chesley?
I don't believe we have had any RNs into the Chesley site other than our agency nurses at this point.
And are they still there? My understanding was one started but then didn't work out, and now we're starting another one. Is that correct?
We do have, we have at least a couple in Chesley. So we have one that started for sure. And then we have a couple others that are going to be starting in the upcoming weeks to help in the med-surg area specifically, and doing a lot of weekend coverage and relief.
Okay. Have we had any RNs leave or apply for postings in other sites?
Audrey, do you have that information up in front of you by chance in terms of our nurses in and nurses that have left?
Yes, I do actually. And we did have one nurse start in our Chesley site. She's working at Chesley Walkerton, and she's an RN. Sorry, I just have to find it again. So she started this week, part-time Chesley Walkerton acute, and she's a novice nurse. Sorry, RPN she is.
So not an RN. And has anyone left Chesley in the since December with ALC?
Just give me one moment.
Thank you.
No, no one has left.
Okay. So there's a method to these questions. I can't tell you how big a concern I have when Chesley went to ALC, as well as half of the Emerge not open. You talked about special education that nurses need to work in a small rural site, and we're not giving it to them in Chesley. With ALC, they are not getting any of the med-surg that they need to continue. And so I have heard that there are a couple of people that are certainly thinking of moving on so that they can stay current. So if we can't keep our nurses current And also the workload of the ALC unit that we have now is very heavy. The heaviest patients from other sites are being moved so that they have open beds, but it means that most of the patients that we have in Chesley now need 2 nurses. A lot of them have alarm beds and alarm chairs. We have patients that have aggression issues and behavior issues. So physically, this is a very taxing group of people that our nurses are doing day in and day out. So besides being tired from COVID, this is even worse. It's also having an effect on our physicians. So we've had a resident who said that everything was lovely, but the part of her training that was missing was she had no inpatients to see. And that's a really vital part for a rural physician. And when asked about, she's coming back to this area, absolutely, she made that clear to us, but she doesn't feel like Chesley will even be here when she comes back, the way this is going. So that's difficult to hear when we're trying to recruit. Our existing physicians are doing our emerge, then they're running to Hanover to help with Hanover emerge on occasion, not getting home even at midnight. Sometimes it's later than that before they get back to Chesley to finish up, and then they're starting their shifts the next day. So we started out with a nursing shortage. We now have recruitment issues, we have retention issues, and we have physician issues. So I'm really concerned about not having active beds. I can't see how we can ever recruit and become the viable site that we were without active beds. So I'm not sure why we can't even put 3, 4, something to give our nurses something to work with. As well, I mean, all I hear is complaints from patients that are being sent to other sites where they don't know anybody, where their families can't get on the roads because of winter, where discharge planning doesn't include the family that's at home and hasn't been in. It's just, you know, it's just one thing after another. I know there's a nursing shortage, and I know that by reducing Chesley's beds, you were able to gain a couple of nurses, but I think what you're losing is Chesley. So I'm done.
Thanks, Sharon. I don't know, Holly, anything you want to add to that? All the comments you're making, like, we agree. We want Chesley to get back to, because I've had nurses say to me, Sharon, that not having those acute beds in place, they want that acute experience. And your example about the resident wanting acute experience as well, we need to get back there. So this is our goal.
Mike, Bruce had a question.
Go ahead, Bruce. And then I see Judy has her hand up as well. So
With that being said, why isn't Chesley number 1 on getting RNs today and get our emergency back? That we're not all acute beds. If something was to happen today, that you had 25 RNs come, okay? So Chesley gets back that it's not acute care, but our hospital's full of acute care. Are we going to have active beds, or are we going to be full of that we can't admit people anyway? Or are the other hospitals going to take their acute beds back?
So I think your question, Bruce, is, you know, if we get the resources back, what reopens first? And so my answer to that has been consistent, that it depends on where those nurses return to, whether it's in Chesley, whether it's in Walkerton, because just as much as Chesley wants to get the inpatient unit back to having acute beds, Walkerton wants to get their emergency department reopened to 24/7 service. So this is our goal, to get there. If we had the resources to be able to do it, we'd be making that decision today, right? We wouldn't be having this call. So we recognize the impact that these changes are having on the existing staff, on physicians, on our partner organizations. So certainly hear you. I'll go to Judy next.
Oh,
Sharon,
hi,
do you want to
Mike.
say something else? Sorry, Judy.
Believe it or
Sharon's
not,
waving at me, so.
It's just, we're defeating our purpose. We're trying to get nurses trained in small rural sites, but we don't have a small rural site to train our nurses in Chesley. We have a nursing home to train nurses in. So unless we get our active beds back, we do not have a site to train nurses in, and they are going to leave.
Yeah, and Sharon, I think the important point here is that we did this to free up our end so that we can continue to operate the services that are still operating. Okay, I'll go to Judy next, and then there's a number of questions in the chat box.
Okay. Hi, everybody. I'm just wondering, Lynn, how they play a part in placing these people in long-term care homes. You know, you've got quite a few in Chesley, and Mike, you know my situation. And I was so upset the other week because there was a resident at Dave's facility who went completely violent. And it was a scary situation. They had to call the police and so forth. It was terrifying. We had to move all the residents out of the area to keep them safe. And yet, when Dave was in care, the biggest thing the girl said to me was we have to get his behavior under control. And his behavior, I've talked to them, and none of them can say that his behavior was ever out of line, you know, and I just think I was put on hold for almost 8 months. Other things happened, but for 8 months he was there. And I don't think he should have been there 8 months. And I don't believe that the girls, I'm sorry, there may be very good girls that work at the hospital there, but I do not believe that they assessed him properly. They put his application on hold. So maybe that's an issue. That's something that maybe you should look at, is really, are they doing the job they're supposed to and getting them placed? And I know that there's rooms that have come available at Bruce Lee right now. I've seen them. You know, they're sitting there empty. There's been 3 or 4 deaths even this, you know, in the last month. So, I mean, it's opening up. You know, the COVID thing is starting to calm down now, whatever. All the mandatory restrictions are being relaxed. I agree with poor Susan, like Chesley shouldn't be. And I felt bad having Dave in Concardant for all the time he was there. But now I'm finding out he shouldn't have been there for as long as he should have. There was a problem. There was a problem there.
Yeah, Judy, you and I have had this conversation a lot over the last stretch when we saw each other quite frequently there. A couple things, just on the ALC issue, there's those patients that no longer require hospital care. They need to be someplace else. Unfortunately, those destinations don't exist in many cases, or the spots that do exist are very limited. We could use additional behavioral support beds in Grey Bruce. There's one pilot project opening up at, I think it's at Grey Gables. It was earlier in Owen Sound. But those types of resources are really required for those people that require that level of support. And I think the other piece is that long-term care homes have just recently, as of February the 1st, now have to operate at 97% occupancy. During COVID, that requirement for 97% occupancy was waived. So it's freed up additional beds to come in that can be opened up for folks to be transferred out of hospital. So that's a good thing. But agreed, we need to make sure people are in the destination that they need. If they don't need acute care anymore, they need to move to that long-term care home or to supportive housing or to home with home care, all of which are facing the same health and resource shortages that we're facing. So the system is very, very challenged right now. Judy.
And just so everybody understands, I have been there for 3 months, and it's not just the hospitals that are experiencing this. It's in the long-term care. I mean, the girls there are working 16 hours. I mean, and in the floor that Dave is on, it's very, very challenging. They're exhausted. And, you know, and there's one gal that she was talking about going to part-time. And now she's going part-time. She's going to have to give up her pension plan. You know, she had 3 days holiday last year. That's all she had, 3 days vacation last year. She's going to go into part-time. Rather than leave, she's going to take part-time. And now she has to give up her pension, you know, and her benefits. Like, our health system is broken. And I don't blame it on just the province or on you fellas or whatever. It's the province too. I mean, they have to step up. Enough of this, with this Bill 124, and Ford's got to wake up and you see what's going on. Like it's a mess, and it's not just in the hospitals, it's in long term. Everybody is suffering. And that's all I want to say. I'm seeing it firsthand, and I'm there helping them. And I mean, I got my hand slapped because I was helping, but I think they realized that, I'm there, and they need people like me there to help them, because they just don't have the resources. They're getting agency people in there, and they don't even know the patients or the resident, I should say residents. And it's a sad situation across the board. That's all I can say.
Okay, thanks, Judy. And you've got some real life experience over this last year for sure. So good perspective. Bill, you've got your hand up. Bill Walker.
Yeah, again, sorry, folks. I was in the chair and I do have a previous commitment because I hadn't heard about this. So I tried to juggle, but I have to get going. But I really just want to say, what I said in the interim in the chat, we are engaged, we are paying attention, we are trying to push both Ontario Health and the Ministry of Health. And Judy, I'm not challenging you, but I will say we've put more money into healthcare, particularly our rural multi-site facilities, in the last 4 years than has ever been there. So there are some things that are happening. There's still lots to do. Getting the nursing program back to Owen Sound, I think, is a good step. It's not going to solve things tomorrow, but there's lots of push on to try to get this. This is something that has been coming, as you're probably well aware. It's not just an overnight thing. Lots of challenges extra with COVID, but there are lots of pushes, and I'm trying to hold both Ministry and Ontario Health accountable to that timeline. And Michael and Bill and other groups are certainly keeping us informed, and Lisa and I are trying to be as involved in that as certainly possible. So I do apologize. I have someone who's already 15 minutes waiting, and I need to get to that because I had already committed to it. So I do apologize. Happy to chat with any of you individually or as a collective group at any time.
Great. Thanks, Bill. And thanks for joining us.
My pleasure. Sorry, guys.
Okay, Megan, should I go back to the chat box?
Yep, I think we're good for now.
Excuse me. So a question from Facebook Live, which Madison's provided. The idea that the way to a nurse's heart is through her stomach. All the food offerings is nice, but really what they need and want is a supportive professional environment, quality of life, and appropriate pay. Totally agree. So all the things I mentioned about the softer pieces of our own retention, those aren't the answers, but they're part of the support, and that we want to demonstrate the value for all of our staff, not just nursing staff, but all of our staff. And I agree totally. Supportive environment, having a manager or leader who's there to support you and coach you. Quality of life, so you're getting the vacation time you need, getting the time off that you want, in appropriate pay. Something, again, many of you around this table may know, but I'll just say it for those that don't. Our collective agreement with our nurses is the same collective agreement that's in place for all 147 hospitals across the province. So it's negotiated centrally. The wage that our nurses make is the wage that's negotiated within that collective agreement. So it's not something that South Bruce Grey Health Centre is providing. It's something that's, again, done across all hospitals across Ontario. And the Ontario Hospital Association negotiates on behalf of the hospitals with ONA and the other RPN unions. And Suzanne asked about the Brockton Review, and Greg responded that where it can be found, it's on the Brockton website. Hyperlink is part of the council agenda, so thanks, Greg, for that. Barb, do the patients in Chesley ALC get offered any open nursing home beds first, or is it according to a list in existence? Judy mentioned about the LIN. It's now called Home and Community Care Support Services, HCCSS. They do the placement for whether someone's coming from community or coming from a hospital. So they base it on priority setting. So it depends on how a patient's prioritized in their choices for where they want to go. So based on that algorithm, that's how they determine who's going where. So it's based on those circumstances. Suzanne, I have had feedback from several nurses, however, none currently employed at South Bruce Grey. So glad to hear you talk about the same concerns they all brought up, namely shifts and vacation. They also did mention sick time being paid differently depending on type of shifts, such as part-time or full-time. The shifts they are concerned about revolved around the long 12-hour versus 8 and having to do multiple jobs due to casual with no guaranteed hours. Yeah, a few good points there. Maybe it's supposed to me talking all the time here. Holly or Audrey, you just want to speak about the 12 versus 8s and then the being paid differently depending on type of shift.
Thanks, Mike. Sure, I can address it, and then Holly, feel free to jump in. So we do hire part-time and full-time staff. Some of our shifts are 12 hours and some are 8. And actually, it's been interesting to hear in the focus groups that we've been having with the nurses, most of them do prefer the 12-hour shifts. And some are asking, actually in Walkerton, to be moved to 12-hour shifts from 8. So it's interesting to hear that feedback for sure. As most of you probably know, when you're part-time, you receive pay in lieu of benefits, which includes sick time pay. So they wouldn't receive additional paid sick time. That is included in their in lieu. Hope that answers the question.
Great, thanks, Audrey. Now, I didn't introduce Audrey to start. Audrey is our Director of Human Resources. Okay, Steve Hamill, Mayor Hamill, I'll go to you next.
Thanks, Michael. And nothing really new from me, but wanted to repeat and ask, and that was the ask that Sharon had this evening as well. Back in December, we did ask for 3 or 4 acute care beds in Chesley. I do believe it's imperative to have that for the future of Chesley, and that would be, to me, a logical first step. And what the second step or third step is, I'm not sure, but that's up to you folks to decide, but we really need that in Chesley, and just wanted to echo those comments and show my support for that way of thinking.
Thanks, Stephen. And we have talked about how we could do this. And as I said, there's 1 acute bed now. And I know your request back when this first was opened up, the conversations opened up, you looked for those 3 beds. So thank you for that again. Mayor Peabody, Chris.
Okay, yes, thank you very much, Michael. Thank you to the board for being so engaged in this. We certainly really appreciate all the attention and work that you've done since this was announced back in December to bring this issue to the fore. And just want our council, we did meet last night, and there was a long discussion about this, and we did receive our third-party report, and we did make a motion to have Bill and Michael come to council and engage them, as well as to work on some of those nurse retention items. So for example, we would be interested in housing, helping with housing. I have found that it's very hard for young professionals to come to Walkerton and find anything to rent. So we would be willing to engage the board and the hospital to work collectively on those items. We are also, just want to emphasize that Brockton Council is committed to Chesley Hospital also. We realize, Bruce, that there's a large number of our constituents up there in Northern Brant, and we don't want to leave you out. And so we're certainly, that's why from the very beginning, we did include Chesley and Walkerton hospitals in all our correspondence about this file, but you're right, it's only in the last 2 months. So the only caveat we had was we were concerned about putting money into this, and then the issue, Michael, I've mentioned this ever since I met you about Hanover poaching stuff from us, and we just are cognizant of we don't want to become a training ground at Chesley or Walkerton for Hanover, just because they do seem to attract our workers, and they do have a strategy that to become a regional healthcare center. So we are we're definitely cognizant of that and worried about that. So that's where we're at with Brockton. And then I'd like to also thank Lisa Thompson, and I know she's very engaged in this issue and behind the scenes has met with a lot of people, met with the board, met with Michael, devoted a lot of her time that she doesn't have as a cabinet minister. And Bill Walker, he's also been very engaged, and sad to see Bill go. He's been a great advocate for rural Ontario.
Great. Thanks, Chris, for those comments. I'll just go back to the chat box. So a question from Facebook Live. I'm a patient of a Walkerton doc who has in the past covered a large number of 24-hour emerge calls. How long will he stay? I don't know that question. I'm not sure if you're looking for a question or whether just making a statement there. And then a couple of Facebook Live comments about Sharon is right, and thanking Sharon Muzel for her comments about the Chesley Hospital. Another comment from Facebook Live. Yes, long-term care home staffing is very hard. And Suzanne, thanks Greg for the information about the report. Bill, how much money has South Bruce Grey saved from the emergency department being closed and reduced? And can that money be put into retention and recruitment efforts? Sure, there's some saving from not employing that RN overnight or the additional staff overnight. And yes, we are, as I've said, this is not a money issue. This is about having the nurses available to us to work for the organization. And we need to improve our recruitment. We need to improve our retention to be able to do that. So that's our goal here. And you can see from the presentation that I made some of the investments that we're talking about. Karen, what is the probability of losing the Chesley site? What would be your next steps? So I can tell you we are not talking about losing the Chesley site. We are talking about getting it reopened. I realize when I say that some people doubt it because this has been going on since 2019. So we recognize that. But we want to have 4 strong, viable sites, and that's what the board has identified as its goal. So there's no intent or plan to close the Chesley site. Any update on the search for a permanent Chesley nursing manager? What a Holly for this one.
Yeah, so as many of you know, I've just been in this role for just short of a month. So just wanted to spend some time getting to know the team and understanding the portfolios and where everyone was best suited for and what people's goals and aspirations were, as well as looking at the staffing model and making sure that we had a good plan going forward. We have posted a number of leadership positions and have actively doing interviews this week and into next week. And the patient care manager for Chesley, that position will be going back up for posting, and we'll be urgently looking for someone and trying to get that filled in the very near future. We absolutely understand how critical it is to get that position filled so the team feels supported, that they have clinical presence on site every day. We do have Jennifer Woodruff doing the interim position at this time, who's done an exceptional job on picking up those extra duties, and we thank her for that. But we do know that we need to get a nursing manager in there soon, so that people know what the structure is going forward, and they can have a sense of stability going forward as well. So no update right now in terms of who that person is, but I can say that we are going to be moving forward with something very quickly.
Thanks, Sharon. And Sharon, you and I have talked about this with the Friends group, is that's a key piece for us, is getting those leadership positions into place. So your urgency around the question is valid. And Sharon adds in, Holly was a wonderful supportive leader when she did an interim role in Chesley, and I wish her well in her new role. So thank you, Sharon, for that. And
I'll say I appreciate that as well, Sharon. Thank you, and to the entire Chesley community. They're a fantastic group there, and I mean, all the sites have a special place in my heart. But I spent some significant time in Chesley, and I appreciate all your comments and your passion tonight that you shared with us, and can assure you that we all do want to get Chesley back to an operating facility with acute care patients and back to full service. So. Thank you for that.
And then a comment from my friend Tessa in Chesley, a nurse. Yes, Holly, we're going to miss you. Okay, other comments or questions? And I think this is Adam, Dr. Winterton, a strong viable site has to have acute care beds. Totally agree. So if people didn't hear this before, when I talk about 4 strong viable sites includes 24/7 emerges in each of them, and having the inpatient unit with in Chesley with the acute beds. I totally agree. And question, is that Dr. Roth, Lisa? Oh, sorry. Lisa Thompson, go ahead, Lisa.
Thanks very much. I just want to share with everyone on the call this evening that you've been heard, and there are many people working around the clock, literally, to support Mike and the hospital board and the nursing staff, the docs, everyone that chooses to call Chesley and Walkerton home. And that includes our local municipal leadership as well. You heard from both mayors, Steve and Chris, this evening. And I can tell you as well, everyone is tuned in, from Ontario Health to the Ministry of Health, working in support of Mike to make sure that your community has the hospitals that you desire. And I really appreciate the frank discussions and the manner in which the Friends of the Walkerton and Chesley hospitals have reached out. And those candid conversations are going to continue. And the most important part is we need to continue to demonstrate the need in rural Ontario for fully functioning hospitals, and work with the people that are in the right places to make sure it happens. And I just want to acknowledge all of you and the work that's being done in terms of advocacy, as well as partnerships in coming up with solutions. And everybody is going to be continuing to support what's happening here locally at home. And I just want to thank you all for being engaged. That's what really matters. And together we'll see those emergency departments open up again and make sure that our nursing teams have the support. And I want to thank the foundation for the extra mile they're going in demonstrating that support. And again, it's about having that environment in which you can share concerns, but most importantly, everyone work together on the solutions. So thanks for everything that's happening at the local level.
Thanks very much, Lisa. And I mentioned this early in the presentation. Lisa did a great job facilitating the first meeting with the Friends group, the Friends of the Chesley Hospital, the Friends of the Walkerton Hospital, to bring everyone together to have a really constructive conversation. And a big thanks to Greg McLean, who's been a leader on that Friends group as well. He's been very diligent, respectful, and professional in his approach with the hospital. So it's very much appreciated. So thanks again, Lisa. There's another hand up, which has gone down now. Suzanne has asked, is someone currently dedicated to having placement of ALCs transferred to long-term care at this time? So yeah, I have regular conversation with Home and Community Care Support Services, which is the old LIN, which is the old CCAC. Their director for Grey Bruce, I speak to on a regular basis and emphasize the importance of moving our ALCs to a more appropriate location or more appropriate destination. So they're very much aware. And actually, we've seen a reduction just in the last week, which has been very helpful for us in reducing those numbers. Rose, I respect this is a South Bruce Gray forum, but as Chris Body is online, has it been considered to give nursing priority position at municipal daycare to a recruitment and retention strategy? Daycare is exceptionally difficult, but even more so for shift workers. A good question. Chris, are you able or willing to answer that one? Thumbs up.
Had trouble unmuting there. Yeah, yes, Rose, that's a great suggestion. I know we had looked at that through COVID. There were some different programs for that. The daycare would not be open in the evening. I think it's open till approximately 6 o'clock. But certainly, as we do own the daycare in Brockton, we would be able to look at that as a policy for all healthcare workers. It's a good idea. We could do that to make Walkerton more attractive. So I will certainly take that to our daycare committee to see how we could facilitate that for our healthcare workers.
Thanks very much, Chris. And Chris mentioned at the start of his comments that during the height of COVID, the county did open up spots dedicated for healthcare workers. So that was very much appreciated, and did a lot of reach out to our staff to make sure that those were available. So appreciate that. And then from the number again, thank you to the support of the Kincardine nurses and staff group. So yes, thank you to everyone. Okay, we said we'd have this meeting for an hour and a half, and it's now 7:30. Questions seem to be drying up a bit here, so maybe I'll pass it back to Bill and for some closing comments, and then we'll wrap things up.
Okay, great. Thanks, Mike. And that last comment with the support of the Kincardine nurses and staff group. My understanding is that's a local support group in Kincardine that provided BIA bucks to all of the healthcare workers in Kincardine. So that was certainly appreciated, I know, by the folks in Kincardine. As we conclude our session this evening, I'd like to begin by thanking our panel members, Dr. Lisa Roth, Holly Al, and Michael Barrett for leading us through this session. Thank you also to Mayor Peabody and Mayor Hamill, MPP Walker and MPP Thompson for their support tonight and ongoing support and future support. To our staff and physicians, thank you for your continued resilience and for your commitment to enrich healthcare in our communities. And lastly, to our partners and community members, your ongoing support is greatly appreciated. With that, I'll adjourn the meeting. Take care. Have a great evening, everyone.